for a larger perspective, not just of what's happening at your range of hospitals, but what you see happening across the country, Dr. Trehan, in phase 2, how successful and how smooth was day 1 of phase 2?
So today was a good day in the sense that it actually, people who have been in a panic all these months, especially the ones who are elderly or the ones who have comorbidities, they felt a sense of relief because they at least started registering. Thousands and thousands of them have registered. We were given 100 doses per center today, out of which 60 were to be reserved for the frontline workers who needed their second dose, and the 40 were for the people who registered or walked in for whom there was space. So that day has gone very well. The only thing that we saw in our hospitals was that a large number of walk-in people came in to register, so that kind of crowded the lobbies and stuff like that, but we were able to maintain the norms of COVID appropriate behavior. So it all worked out beautifully, but we were prepared for it. So now this is going to, the numbers are going to be ramped up in the next few days, so that we go to from 100 to 200, 200 to more, and you can go up to thousands actually, like places, the hospitals like Medanta have 25 stations, so we could do 100 in each station, so 2,500 is easy, and we can double it if we extend the hours. So there is a lot of capacity available. What the government did a good thing was, one, that the prices are controlled. So for 250, including that 100 rupees, which is the allowance for the people or the hospitals who are going to administer the vaccine, it all becomes very affordable, and lakhs of people have registered already. Like we all have patients who are either heart patients or diabetics or cancer patients, hypertension, you name it. So there is a large number of people who are seeking us anyway, and that beyond that, so many other people are registered. So I think that this is a good move. What the Prime Minister did this morning also helped. And then the senior leadership like the Home Minister and others have also taken it, and they are talking about it. So now is the time that the hesitancy will probably go down significantly, and the ones that we are offering it to today are the ones who have been actually worried about the fact that when will they get protection from COVID. So I expect very large numbers to come in. We are registering them, and I think when we are full swing by next week, we would be vaccinating, I would say, lakhs and lakhs of people around the country.
Abhay Soy, what's it like at Max Healthcare? How many people were you able to vaccinate at your various hospitals through the day? What was the experience like? What are your plans for scaling up? Abhay.
So Rahul, this is clearly an inoculation drive of absolutely humongous proportions, never been done at this scale before. It's also a collaboration between the government via its application as well as providing vaccines and so on, and the private sector. We, for one, were able to vaccinate a little over 1,000 people today. The vaccination drive started a little later at about 12 o'clock because, you know, of the huge amount of people who were sort of, uploading onto the COVID app. And as expected, a bit of a glitch over there as well, because just the volumes were absolutely immense. But I think by later in the afternoon, we were able to, and again, you know, even to get our own processes in place, have been in place because we've been vaccinating our own healthcare workers. But to do it, to handle the sort of crowds who were coming at the hospital sites directly without taking appointments, it is something that one has to sort of get used to. We were able to streamline out of it. Tomorrow, I believe, will be a better day. Of course, there were hitches and glitches as one would have expected at various sites. But I think tomorrow is going to be a better day, and we should be able to ramp up significantly.